Time is running out. Tomorrow is the deadline for you to sign up for health care coverage through the Affordable Care Act. So we have experts to help you navigate that process. Catherine CVA is with AARP of North Carolina. Morgan Campbell is with Alliance Insurance Services, and Laura Packard is with Get America Covered. Now, they're all here to answer your questions, and here's how it works. All you have to do is text us your question. The number is 336-379-5775. Remember, this is a text only. Please don't call, but we can answer all kinds of questions when it comes to healthcare and healthcare coverage, as well as Medicare as well. All right, first and foremost, Laura, let's start with tomorrow's deadline. What do folks need to know about the deadline, when it all starts, and all that jazz?
Okay, if you don't have health insurance right now, you should go to healthcare.gov before midnight tomorrow, January 15th, to enroll. And this is the deadline for the open enrollment period, the standard one for everybody. If you have life changes such as having a baby, getting married or divorced, or moving to a different county, you may be eligible to get insurance later if you lose your insurance through your job. But for most people, tomorrow is the deadline. So go to healthcare.gov and sign up today.
Okay, so that is what you need to do. Now, if you're thinking to yourself, I'll just let whatever I had last year be what I'm going to have this year, or I'm just going to pick the first thing that's on the list. Morgan, let's talk about that, because I know that there are a lot of plans that are decently inexpensive, like maybe $10 a month for the premium, and they all have different coverage points.
They all do have different coverage points, and also let's talk about the network. If you are a Novant person and you might have been automatically enrolled in a plan that just uses Atrium Wake Forest Baptist, that's going to require you to give up your Novant positions. So you have to check that network. Also, you need to look at the drug coverages that are built in, because there's been some changes as far as there were copays. Some plans do have copays. Other plans now will have a co-insurance split. So you might have a drug that you were used to paying $40 for, and now you might actually pay $80 for. So check your formulary, check your network and your doctors.
Right, because just because your doctor was in your network last year does not mean that your doctor is going to be in your network this year in that same plan. So you have to do all of the checking. Okay, so we've got ACA, we've got healthcare enrollment. That is tomorrow. Now let's talk a little bit about Medicare, Catherine, because while the main yearly enrollment is over, anyone who is of a certain age has a certain timeline to sign on for Medicare. So let's go through that.
Sure. So if you are approaching your 65th birthday, 3 months before the month of your birthday or 3 months after, you need to sign up for Medicare. Whether or not you are working, you need to check in and either indicate and sign up for Medicare, or indicate that you have coverage through your employer that meets Medicare standards. The important thing about that too is you need to look at enrolling in Part B Medicare, because if you miss that window and decide later that you want that coverage, you will pay a penalty, not just for 1 year, but continuously for every year that you missed.
Okay, so 65, that is the magic age.
Number.
And whether you are still working or not, you still have to sign up for Medicare, and then you can defer things, but you must sign up, otherwise you will pay a penalty. Do not miss that, folks, because that is a problem, and that is something that we want to talk about. All right, the other thing we want to talk about also is the home tests. So the COVID at-home tests, they're going to be covered by the government starting tomorrow. So Morgan, what do we need to know about that?
So starting tomorrow, if you go to your local pharmacy and you are able to purchase a rapid test, please keep your receipt. I would also tell you, keep the box. We do not have clear clarification right now as to exactly how that reimbursement process is going to work. So you will have to manually file that reimbursement with your health insurance company.
Yeah, I know the best case scenario is that the administration was trying to push companies to partner up with like a CVS or whatever so that you could just go there if you had that insurance and just get your at-home test and not have to worry about paying for it up front. But that is not the case at the moment, as we're seeing that that's how it's working out. Is that correct?
That's correct. At the moment, what we do know for a fact is that you are allowed 8 tests per month for every person that's in your household that's on your insurance plan. And we do know that as of tomorrow, it will be set up as a reimbursement feature. So you will have to file that claim yourself.
Okay, keep that receipt, people, and keep the box. All right, we are just starting our Q&A of healthcare open enrollment and Medicare as well. Make sure you get your text questions in. We're going to take a quick break. We'll be right back.